Can the way you eat impact the severity of your psoriatic arthritis? Patients ask me about this a lot. Here's what I tell them. While there's not great evidence that your diet can have a big impact on your symptoms, making certain changes may help you feel better. First, if you're overweight or obese, losing weight is one of the healthiest things you can do for your psoriatic arthritis. Having a higher body mass index, or BMI, is linked to greater severity of psoriatic arthritis, and we know that psoriatic arthritis increases your risk of other conditions that can be affected by weight, such as heart disease and diabetes. Another smart thing you can do is to add more fish to your diet. Salmon, trout, mackerel, and sardines contains omega-3 fatty acids that can help lower inflammation, which plays a role in many conditions that affect psoriatic arthritis patients. Make other heart-healthy choices since psoriatic arthritis is associated with heart disease. If you have high blood pressure, read food labels to see how much sodium you're eating. Cut out trans fats from your diet by looking for words like partially hydrogenated on ingredients lists. Swap out butter and other oils for extra virgin olive oil. Some research suggests that it could help psoriatic arthritis comorbidities. Olive oil is a big part of the Mediterranean diet, which research has linked to a lower risk of heart disease and diabetes. Eating more beans, nuts, legumes, seeds, herbs, and spices can make your diet more Mediterranean. Load up on veggies, especially broccoli, kale, cauliflower, and Brussels sprouts. A recent study found that women who ate more of these vegetables had lower levels of inflammation. Talk to your doctor about vitamin D, which is found in eggs, mushrooms, milk, and fortified foods. Some studies suggest that people with psoriatic arthritis are deficient in vitamin D, but more research is needed to see if increasing vitamin D level can actually impact symptoms. These changes can help make your diet more anti-inflammatory, which is just overall good for your health. But remember that these are just one part of your treatment for psoriatic arthritis. They're by no means a substitute for medication or other treatment.